an old lady of age around 60 to 65 years. From past 5 years, she was really restless. After every few days, she used to have severe headache. Because of this, along with her grandsons, she visited many hospitals and clinics. MRI scan, CT scan, everything was done, but nothing was coming out. Then doctors suggested her to visit a psychiatrist. She came to Dr. Rajiv Sharma's Beautiful Mind clinic along with her grandson. While talking, she was little hesitant. Doctor asked the grandson to wait outside. While making a diagnosis and asking questions, Dr. Rajiv asked her, does she get ill thoughts about God? She had tears in her eyes and said, yes doctor, I see and feel sexual images related to God, and she started crying. Because of this, she was really upset and stressed from past 5 years. She was unable to share this to anyone, and she used to feel that she might have done some sins in her past, that she's getting all these thoughts and images in her mind. Then Dr. Rajiv told her that she is having OCD, means Obsessive Compulsive Disorder, and this can be treated with the help of medicine. Initially, she couldn't believe this, but after seeing the positive results of the medicine in 2 to 3 months, she told doctor, it's been years that I have felt so relaxed and happy, and I started my normal routine life. She told, I never knew that I have OCD and it is curable. Dr. Rajiv Sharma tells OCD means Obsessive Compulsive Disorder. Disorder means if any person is not able to perform his daily basis of activity as normal, it is a disorder. According to research, out of every 100 people, 2 or 3 people have OCD, whether they get it treated or not. Dr. Rajiv Sharma tells because of OCD, lots and lots of time is wasted, because of which 50 to 70% of people go into depression, and in some cases, patients even go to the extent of self-harm and suicide. OCD have 2 parts, obsessive and compulsive. Obsessive means thoughts in our mind, and compulsive is behavior because of these thoughts. Let's understand obsessive. Obsessive have 4 parts. First, irrational thoughts. Patient is aware that the thoughts coming in his mind are irrational, but still he is unable to control them. Dr. Rajiv Sharma shared a case in which there was a patient whenever he used to step out of his house, and if on the way there is any gurdwara, temple, mosque or church, until he bow down and pray 5 times, he was not satisfied. He used to imagine if he does not stop and bow and pray, then something bad will happen. Number 2, repetition means again and again the same thought and imagination comes to his mind that this man used to feel if he does not pray 5 times, a family member may die or they may have an accident. Number 3, unable to resist. Despite of the fact that patient is aware that nothing is going to happen, but still is not able to stop himself until he prays for the 5th time. Number 4, distress. Because of this habit, most of the time he was late to office and he even got an warning letter. Family members were very irritated because of wastage of time. This is called OCD or Obsessive Compulsive Disorder for God. Obsessive means thoughts and compulsive means our behavior because of these thoughts. When Dr. Rajiv was doing his MD from All India Institute of Medical Sciences AIIMS, during his emergency duty, he was taking history of a patient. The patient was a young man of 25 years, very good looking and very well educated. He attempted a suicide, and because of that he was admitted in an emergency ward. His parents shared that from past few months he was really sad and depressed, and we think because of this he tried to commit a suicide. Considering it as a case of depression, he was admitted to a psychiatric ward, but after taking detailed history, something strange came out. Patients shared that he used to get sexual thoughts and images for her niece. He used to feel that he is having sex with her niece, and he used to imagine this and see this very often. Because of this, he was really stressed and depressed. He started thinking that he is not a good person. That's the reason all these thoughts are coming in his mind for his niece. He used to feel very bad about himself, despite of the fact that he liked her niece very much and used to take care of her in a good way. He was unable to share and discuss his thoughts with anyone, and considering himself a very bad person, he tried to commit a suicide. Then it was diagnosed that he is suffering from OCD of sex, Obsessive Compulsive Disorder. After taking the treatment and medicine, within 2 to 3 months, he started seeing the positive results in himself. Doctor tells if any person is wasting every day at least 1 hour continuously for 2 weeks thinking and seeing irrational thoughts about sex and God means he is suffering from OCD of sex or OCD of God. Dr. Rajiv Sharma shared that there are some cases in which people get so weird imagination about sex and God that they themselves feel guilt and shame about themselves that they get such weird ideas, thoughts and imaginations. We find it very odd while saying, but it is very important to share the correct information. There are people who get thoughts in which they are urinating or passing motion or stool on God. After seeing a God picture, some patients start saying bad words and evil things for God. They curse themselves but unable to stop themselves. They get very upset and stressed out by them. They are unable to share and discuss this problem with anyone. They consider themselves as very bad humans and they feel they might have done some evil sins that God is cursing them with these thoughts and imagination. All this either lead to depression and in some cases even to an extent of a suicide. Friends, in Hindi there is a saying, वहम की बीमारी का इलाज तो हकीम के पास भी नहीं है. Means there is no cure for thoughts and feelings, but definitely a psychiatrist and a psychologist can help the patient to come out of this. Psychiatrist will prescribe a medicine which will start showing its positive result in 2 to 3 months and which need to be taken for 1 year and in some cases maybe longer. Consultation sessions with psychologists are really helpful to understand the symptoms, treatment and cure for OCD. Few years back, getting information about all this was very difficult, but now with the help of YouTube videos, we can get all the information easily. Obsessive compulsive disorder may be related to many other things. For that, we have separate videos, you can watch them. So Rajiv and I, Monica, and a Beautiful Mind Academy have a mission to share correct information and help millions and millions of people. And if you wish to join our mission, do subscribe, like and share this video with maximum number of people. If you have any suggestion or queries, please share and comment and press the bell icon to get immediate notification. We'll keep on adding such informative videos. If you don't want to miss, do subscribe to this channel.